Hi, my name is Grace, and my project was on melatonin, the sleep hormone. What is melatonin? Melatonin is a hormone that is synthesized and secreted in the pineal glands of the brain. The pineal gland is a small organ that looks like a pine cone and is located near the center of the brain. Melatonin has two primary functions: to regulate reproductive hormones and help control the circadian rhythm by signaling your bodies when to fall asleep and when to awake. Our bodies control how much melatonin we produce and when to release the hormone. However, melatonin is not a sleep initiator and only helps regulate our biological clock. Melatonin is also known by other names such as MEL, MLT, pineal hormone, Dracula hormone, and such. It is called the pineal hormone as it is created in the pineal gland, and the Dracula hormone as it is affected by light. Melatonin levels are typically increased during the mid to late evening when the sun is set or is about to set. Melatonin levels typically remain elevated for the majority of the night and drops in the early morning as the sun rises. The environment's lighting has been proven to correlate with the levels of melatonin, which is why many people tend to feel very tired during the winter when the sun goes down earlier and the days become shorter and darker. During the chilly, dark days of winter, many may experience a decrease in energy, fatigue, mood changes, and other symptoms of tiredness because our body produces melatonin earlier in the day during the winter than our body typically does. Lighting can decrease the levels of melatonin as well. Studies have shown that light such as blue light can suppress melatonin. Although being exposed to other forms of light can interfere with melatonin secretion, blue light is one of the most impactful lights. Being exposed to the smallest amount of blue light can influence a person's circadian rhythm and melatonin. Other researchers have proven that light can go against and suppress the function of melatonin, since the melatonin is very sensitive to light, which is why it's known as the Dracula hormone. Harvard University had conducted an experiment to see how influential blue light is for sleep. There are two groups of test subjects, and one group was exposed to blue light for 6.5 hours, while the other group was exposed to green light for 6.5 hours. The results showed that the group who were exposed to green light experienced a 1.5-hour suppressed and shifted circadian rhythm, while the blue light group experienced a 3-hour suppression. Many food contain melatonin, and there are vitamins and minerals that aid in sleeping, such as tryptophan, magnesium, calcium, and vitamin B6. Tryptophan is a type of amino acid that becomes serotonin, the neurotransmitter, which becomes the hormone melatonin. Foods such as dairy products, like milk and yogurt, as well as other foods such as poultry, nuts and seeds, legumes, grains contain high levels of tryptophan. Magnesium is known as a sleep mineral as it helps lower levels of adrenaline and helps the body relax. Deficiency in magnesium can cause sleep issues such as having difficulties sleeping or staying awake. Dark leafy greens, nuts and seeds, soybeans and wheat germs are rich in magnesium. Although magnesium is not directly related to melatonin, patients with sleeping disorders are recommended to take magnesium to relax and additionally take melatonin to regulate the sleep cycle. Calcium is another mineral that helps the brain create melatonin, and many studies have shown that a lack of calcium can cause you to wake up throughout the night and fail to go back to sleep. Many patients with insomnia and other forms of sleeping disorders are advised to eat calcium-rich diets. Dark leafy greens, low-fat milk, cheese, yogurt, sardines, anchovies, and broccoli are great sources of calcium. Lastly, vitamin B6 is another source that aids sleep. B6 also transforms tryptophan into melatonin, and deficiency in B6 can lead to low levels of serotonin and inability to sleep. Sunflower seeds, flax seeds, fish, dried prunes, bananas, avocados, and spinach are some of the highest sources of B6. Milk is rich in calcium, tryptophan, as well as magnesium, which is why warm milk is recommended to drink when trying to fall asleep. Levels of natural melatonin are usually increased 2 hours before bedtime, or in other words, when your biological clock tells you to go to sleep. Making your surroundings best for sleep by lowering the brightness and avoiding blue light is recommended for best sleep and unaffected melatonin levels. Supplementary melatonin typically is kicked in 30 minutes to an hour after consuming, and it is advised to not drive for an an hour and 5 hours after consuming melatonin, for it is dangerous. Physical effects of melatonin include a decrease in energy, tiredness, sleepiness, fatigue, drowsiness, and much more. There are two main forms of melatonin pills, natural and synthetic. Natural melatonin is made out of the pineal glands of animals, and many doctors advise against them for they have chances of contamination with the virus. Synthetic man-made melatonin, on the other hand, has no risk of virus and is approved by the U.S. Food and Drug Administration on some levels, but is not approved for particular uses, and therefore its level of safety is not guaranteed. Supplementary melatonin can be found in local pharmacies and is easy to get. Supplementary melatonin is available in pills, liquids, and chewables. Scientists are also unsure of the long-term effects of melatonin, and therefore, melatonin is only recommended for short-term uses only. Melatonin is being used for non-medical uses, such as to treat jet lag and to help adjust to night shifts, but it's also being used for various medical purposes. It is mainly being used to help patients with sleeping disorders such as insomnia to set a sleep cycle and to help them sleep at the proper time. It is also being used to help blind people establish a day and night schedule, treat delayed sleep phase syndrome, a sleeping aid, discounting the use of benzodiazepine drugs, reduce the side effects of quitting smoking, and help dealing with the Alzheimer's disease, memory loss, bipolar disorder, side effects of cancer treatment, and to help people relax before anesthesia for surgery. Melatonin is also applied to the skin to protect against sunburn and inserted to the muscles to help treat cancer. As previously mentioned, synthetic melatonin is not considered a drug and therefore not 100% checked and tested by the FDA. Therefore, the signs and labels on the melatonin products may be inaccurate, and studies have shown that 1 to 3 milligrams of melatonin, supplementary melatonin, can elevate natural melatonin levels by 1 to 20 times. Some of the short-term and long-term side effects of melatonin include headaches, dizziness, symptoms of depression, daytime sleepiness, stomach cramp, and irritability. Melatonin is possibly unsafe for pregnant women and breastfeeding women to take, and melatonin also affects ovulation and may cause difficulties with becoming pregnant. Single small doses of melatonin are most likely safe, but long-term uses of melatonin may affect hormones and may interfere with development during adolescent years for children. Patients with bleeding disorders, depression, diabetes, high blood pressure, and seizure disorders and are transplant recipients are advised to not take melatonin, for it may increase and make worse of the disorder. Birth control causes some bodies to produce more melatonin than usual, therefore less amounts of melatonin should be consumed supplementarily. It is advised to not take melatonin on birth control because the two chemical mixtures can crash. Caffeine is known to help people stay awake, but it can actually cause a decrease or increase of melatonin levels in the body. Coffee consumed with melatonin can actually increase the levels of melatonin even more and cause a crash. Thank you. Bye.